Welcome to our very first provider education video. Everyone hates going to meetings and nobody listens. So hopefully with this video, we'll be able to reach out to you in a fast, efficient, and effective way and not create an interruption to your day other than the very brief educational video you're about to watch. In this video, we're going to be covering an important topic for our group, advanced care planning. Now, why are we going to cover advanced care planning? Why is this important to the group? The first reason to have this discussion at the AWV is to assist the hospitalist in providing really better care. Having the discussion with a doctor you've never met in the hospital is just not ideal. The next reason to have this discussion is because certain diseases really just mandate that we bring up this topic. End-stage renal disease, end-stage heart disease, certain illnesses really just warrant, hey, this discussion needs to happen at the AWV. And then finally, we all know that at the end of life, there's a lot of expenditure for care, and we're trying to utilize the resources most appropriately. Now that we've reviewed the reason why we're talking about this topic, let's cover a couple definitions that are very important. So the first category is comfort care only. Now in this category, the patient is typically not going to go to the hospital or the ER to seek care. This is a patient when they become short of breath, for instance, will use morphine, and often hospice care will be called in. The more common category that we're going to use in the office is comfort care arrest. This is a patient who's at a point in their life where they would say, if my heart stops, no CPR, go ahead and let me go. I'll often cover with the patient also whether they would wish to be on a breathing machine. Now, if the patient does convey a wish to establish a DNR status, the next step is to complete this form, the State of Ohio DNR form. Now, this form is not needed if the patient chooses to have a full code status. And oftentimes when I complete this form, this is the validation for why I've spent greater than 16 minutes, and I will bill the CPT code 99497. I always give a copy of the form to the patient, and if there's a family member present, and I'll encourage them to put this on their fridge. All right, now let's look at the template that is provided for us to use during the AWV. Each part of this template covers the exact requirements for documentation to be able to bill for this discussion. The first step in the template is to be sure the patient understands that the process is voluntary. They have to have the right of refusal here. The next step is to document the reason for advanced care planning discussion. There are some pre-entered selections for you to pick from that makes this very easy. The third step is to document the decision level that the patient has chosen and also document who the patient chooses as their surrogate decision maker should they be unable to speak. Now, the final step is to document the amount of time that you've spent on this discussion, whether or not you completed the State of Ohio form, if in fact they chose a DNR status. And then finally in the comment section, I usually give a little description that supports that I've spent greater than 16 minutes if I'm going to be billing the CPT code. Now remember, Debbie Gusty did send us an email with all the pertinent information to complete this process, and please reference that as well. And remember that this advanced care planning can occur at any visit with any provider. All right, so that completes our first provider education video. I hope you found something here to be helpful, and thanks for listening.